next thing we're going to talk about is Thanksgiving. I'm going to make some brief remarks and then turn it over to Dr. Stack. Thanksgiving is one of my favorite times during the year. It is a special time for my family that is normally spent with a lot of extended family. But this year, those larger gatherings can be very dangerous. Those that you may think that you may only have 5, 10 Thanksgivings left with, if we're not careful this year, you might not have more than one. We are seeing spread and we are seeing the resulting loss happening more at family and social gatherings than anywhere else right now. And we've already seen this happen in Canada. So Canada has a Thanksgiving that is in October. It is earlier than ours. And what the Canadian government has been disclosing since then is that they have seen significant spread through these gatherings. If you travel, now, again, we're putting people at risk, not just because of the travel, but because of the size of the gatherings. And in Thanksgiving, everybody's going to take their mask off and eat and drink and probably be inside. And all of those things are very concerning. Now, this doesn't mean anybody is suggesting Thanksgiving's canceled. Far from it. We ought to celebrate our blessings. We ought to be able to be in touch with each other through Zoom, but we ought to be thankful for having the knowledge of how to protect those around us. So, you know what? 2020 been rough on a lot of things, and it's going to be a little rough on your Thanksgiving gathering. But we're asking you and we're pleading with you to do it right, because that person that you may think that you will really miss sitting across the table from you this year, I want to make sure is across the table from you next year. And this right now is the most dangerous time we've had in this virus. So with that, I know Dr. Stack has some comments on that too.
I'm on mute. I caught myself before you had to correct me that time, Governor. So thank you very much. With respect to the Canadian news article that the governor shared, that was from late October. And just to put this in context, we're in the middle of a global pandemic with an infection that spreads easily by droplets, respiratory droplets, snot, saliva, spit, all those things. And let's put that all together with what Thanksgiving and other holiday gatherings look like. We take a large number of people, often from different households and from different states and cities and regions. We put them indoors in a small confined space. We usually put more people than that space was intended to hold because we pack everybody in so we can get together. We take off our masks if we're in that setting, or usually wouldn't be wearing a mask. We eat and we drink, which increases our salivation. You've all done this. You eat food and you produce more saliva to help break it down. And then we talk and we laugh and we joke and we shout and we sing and we do all sorts of things that spray that saliva throughout the room. That is a perfect recipe to spread this virus. So as you make your plans for the holidays, I urge you, please, 2020 has been a mess. It's been a mess for all of us. We got to hang in there just a little bit longer. We are very optimistic, and the first signs for the first vaccine to report information from its major trial is suggestive that our scientists have been able to figure out ways to give us a tool to help get back to lives more like we used to know it. So I urge you, please, as you plan your holidays this fall, don't do the things that make us at highest risk. So before I transition to our specific guidance, the White House report came out today, and I got this just before the press conference. I'm going to read just a few bullets. Message to communities, basic actions they should take now. Do not gather without a mask with individuals living outside your household. Always wear a mask in public places. Stop gatherings beyond immediate household until cases and test positivity are in the yellow zone. We have no counties in the yellow zone today. no counties in the yellow zone, and get your flu shot. Also says, in accordance with CDC guidelines, masks must be worn by students and teachers in K through 12 schools. I get some communications with people very frustrated about wearing masks in schools. The White House is telling us we have to wear masks in K through 12 schools, teachers and students, and work with hospitals, local leaders, chambers of commerce to create and communicate messages for Kentuckians to adopt about the risks of gatherings outside the home and the importance of wearing a mask. This message should be tailored to rural communities. So look, I know there are some who aren't going to listen. I hope you listen. I'm urging you to listen for your own well-being and that of your family, your friends, your neighbors. But for all of those of you who will listen, this is a year to do Thanksgiving differently. And if you could put up the slide that we prepared for this purpose, James, thank you. So here's our guidance. Avoid in-person gatherings with people who do not live in your household. I know this is a sacrifice. It's a smaller sacrifice than having one that we care about or love get sick, have a prolonged recovery, or heaven forbid, die. Always wear a face covering or a mask, always when you go out in public. Maintain a social distance of 6 feet or more. And remember, when you're out in public, it is both distance and the mask. Avoid large gatherings of any sort, but particularly those that are held indoors. If it's warm enough, if the weather's good and you're outdoors, we have come to learn that that is a lower risk and a significantly lower risk. But please don't hold gatherings. Don't participate in large gatherings indoors. Do not host or attend crowded parades. I would have said parties here, but do not host or attend crowded parades. I think that would be Macy's Thanksgiving Parade and all of those sorts of activities. So please, in small towns, I suspect that there's a big part of this that could be on tap. And so please don't do that. And as you go shopping, and you will go shopping, please avoid the crowded stores, stagger yourselves, space yourselves out, and please don't go into crowded stores before, on, or after Thanksgiving. This means Black Friday. It's got to be different this year. If everyone's all packed in there running around, that could take an otherwise relatively safe experience of shopping in a thinly populated store and make it a more dangerous experience. So please, I urge and ask you to follow these things. I have one final thing before I hand this back over to the governor. We are in a very different place in a lot of ways than we were in the spring. And I want to urge you all, if any of you need medical care, seek medical care. If you have chest pain, if you have abdominal pain, if you think you're having a stroke, do not delay, go seek care. Call your doctor, see your primary care provider, go to the emergency department if you believe you have an emergency. The hospitals, the doctors, the other clinicians are prepared to keep you safe and to treat you and to evaluate you. Please do not delay or fail to seek care if you think you're having an emergency or an urgent medical or surgical problem. Now, that being said, I'm beginning to get the glimmers of more outreach from more different regions where hospitals are very clearly noticing the increase in COVID patients in their hospitals. It is possible that you could find, and is actually quite frankly likely in many areas, that you will find that some of the things that you wanted to get done may not be able to be done and may have to be postponed as the hospitals turn their attention to treating more patients with COVID. It is also possible that if you seek emergency care, you could have to wait in the waiting room for a little bit. Please do not delay. Go seek care if you feel you have an emergency, but you're also going to have to be patient because it would look like the hospitals are going to begin to see a steadily increasing volume of coronavirus patients, and they will have to turn their attention to make changes necessary to accommodate that need. So I hope you'll please consider very thoughtfully and seriously the Thanksgiving guidance. Please note again that the White House and the state of Kentucky, Governor Beshear, are recommending the same basic guidance to you. We really urge your attention to this, and I hope you will help us see it through the end of this year, because next year, I believe, I have every reason to be confident, we'll start to look better and we'll be able to return to some of the things we miss so much. Governor Beshear, back to you.
Thank you, Dr. Stack. And I hope those out there were listening. Whether you believe advice from the Beshear administration or the Trump administration, it's the same. It's the same. And that's right now only gathering with the members of your household are safe. And I know Dr. Stack chuckled about the parades, but I want to take you back to March because remember what a parade can do. When we were always talking about the Spanish flu, we talked about Philadelphia versus St. Louis. Remember, it's that large gathering. It was that major parade post World War I that caused that spike in Philadelphia. So, to all of our communities, do not hold big events that bring people close together on Thanksgiving this year. Remember, it's the same community response we're asking for. We're asking for sacrifice from households, and we're asking for sacrifice from communities.